Now, I mentioned previously that your genetic code is just predispositions. They're probabilities, likelihoods. Just because you have something in your genetic code, that doesn't mean that it's going to necessarily affect your development. The environment triggers those aspects of your genetic code, so it's really up to the environment to shape your development in that manner of speaking. And there's a lot of things in the environment that play a significant role in shaping a developing baby before it's born. The first of which would be nutrition, so the kinds of foods that the mother eats. Remember, when a baby's developing in the womb, it is completely dependent on the mother. So if the mother is eating well and increases their caloric intake by about 10 to 20%, which is what babies need, and you generally don't need to convince a pregnant woman to do that, it just comes naturally. So as long as she's eating a little bit more than she normally would, and she's eating a good balanced diet, then the baby will, benefit from that. Their development will be boosted, basically. And there is a consequence to this, though. As women consume more calories and consume more foods, they will generally gain some weight. So most women gain about 25 to 35 pounds, but if the woman is initially a bit underweight, it could be as much as 40 pounds, and if she's overweight, it could be as little as 15 pounds. But it is very important that the pregnant mother increase their consumption, because the baby does need proper nutrition. One particular example of something that could go wrong is called spina bifida. And this is when the embryo's neural tube does not close. And this is due to failure to consume adequate amounts of folic acid. But that's just one example. Another factor in the environment that plays a significant role on this prenatally developing baby is stress. But this is a factor that most people don't really understand how important it is. Like, most people understand, pregnant women need to eat right, but most people don't really talk about how pregnant women need to not be stressed out, because those stress hormones will fundamentally change the environment that this baby is being raised in, and those changes could have some pretty serious negative effects. Now, you could just define stress as simply a physical and psychological response to a threatening or challenging situation. Like, whenever you're put under any kind of threat or challenge, your body's chemistry does change fundamentally. And we've done a lot of research on pregnant mothers who were significantly and chronically stressed. And what we've found is that they have children that generally are born earlier with a lower birth weight as a result. And those children, as they get older and they enter school and preschool and whatnot, they will typically have attention problems and behavioral problems. And just in general, these kids tend to be physically, cognitively, and linguistically underdeveloped for their age. But none of these things are a guarantee. Just because your mother was significantly stressed out, it doesn't mean that it's necessarily going to have these kinds of influences. But there's a much higher risk of this kind of stuff coming true. But one thing in particular that I find really interesting, something that isn't talked about enough in my opinion, is how stress can affect the gender and sexuality of a child. There's been a lot of research done on something called the prenatal hormonal theory of sexuality. And the basic idea is, due to changing stress levels in the pregnant mother, this can result in the child's sex hormones, which are basically synonymous with a lot of these stress hormones, the child's sex hormones changing during development. So a child that was initially developing into a little boy, suddenly there's a dramatic shift in the hormone levels, and now they're not moving down that path anymore. They're going down a different path. So these things are, like I said, these things are hard to predict. Just because a woman is stressed, it doesn't mean these kinds of things are going to happen, but the risk is there. This is a very real risk factor. So as I told my wife, as I tell all pregnant women I know, when it comes to these two general risk factors of nutrition and stress, is if you become pregnant, what I would tell you is your job is to be fat and happy. You know, that's the environment that your baby needs. A fat, happy mommy. But there's other factors as well. Things like age, for example. I'm sure you already understand that women shouldn't have a baby at a very young age, and they shouldn't have a baby at a very old age. The optimal age, based on the research, in fact, seems to be between 20 and 35 years. Now, that's going to vary from person to person, you know, it's just an average. But there's a reason why we say that this is a good range. You know, women in this range, they tend to be a bit more intellectually developed, a bit more mature, a bit more financially stable as well. But their body is still very healthy and young. They're at their physical peak in their early 20s. And, you know, this provides for very good like physical environment for the child. So women in this age range tend to be very good physically and psychologically and financially able to provide an environment for this child. Whereas on the other hand, older mothers, while they might not have as much stress, while they might not have as much concerns like about money and whatnot, they do start to have some deterioration, some very real deterioration in their reproductive capabilities. And this results in them just having more difficulty getting pregnant. And if they do get pregnant, there's a much higher risk of miscarriage. And if the child does come to term, if the child is born, there's a much higher risk for serious mutations in that child's genetic code that could result in something like Down syndrome. So all I'm saying here is you don't want to have a baby when you're too young, because you're probably not going to be able to handle that baby due to things like stress and money. And you don't want to have a baby when you're too old. So don't a lot of people have this idea they'll have a baby when they become financially stable, but you don't want to do that. You'll be in your 60s. You want to have a baby when you are financially stable enough, but you're still, you know, in your 20s or 30s. That's the ideal point to have a baby in today's world. Now, when we talk about the environment and how it can shape development, those three things, you know, the mother's age and nutrition and stress, those are generally really important factors. But there's other specific things that could play a role that are in particular quite harmful. We call these teratogens. So a teratogen is just defined as a agent that causes abnormal prenatal development. And there's lots of them, but you could basically group them into different categories, like diseases and drugs and environmental hazards. So here is a table showing just a few of the drugs that could do harm to a child's development prenatally. So I'm not going to go down through the list and describe all the stuff, but if you're interested, you could just pause the video and take a look. But you can see just in general that pretty much any psychoactive drug, even if it's really mundane, like caffeine or marijuana, any psychoactive drug can have detrimental effects. So if you are pregnant or you think you might become pregnant soon, you should just try to stay as clean as possible. You know, no more coffee, no more cigarettes, no nothing. Just put that stuff away for a few months and your baby will benefit substantially for it. But there's one drug in particular that has historically caused a lot of problems, and that is alcohol. It's fetal alcohol syndrome is the resulting disorder, which affects babies whose mothers consume large amounts. Now, that's kind of an important point. If you're a pregnant mother and you have a beer every so often or a glass of wine every so often, it's most likely not going to result in fetal alcohol syndrome. Fetal alcohol syndrome only tends to result from large and chronic consumption. But I'm not saying it's okay to drink. Pregnant women should definitely avoid alcohol entirely because you don't want to run that risk. You know, it's not worth it. Having a beer every so often is not worth the risk of fetal alcohol syndrome. because infants who are born with fetal alcohol syndrome have a lower birth weight, tend to have a smaller head, specific kinds of body defects, and stereotypical facial malformations. But more importantly, they tend to have emotional, intellectual, and physical handicaps. And it's just kind of a sad story because these individuals, obviously, they did nothing wrong. It's the choices of the mother, it's the actions of the mother that have resulted in them having to suffer a lifetime impairment. And that's just incredibly depressing to think about. So let's move on. I don't want to talk about this anymore. There's a different, another syndrome related to drug use that we do see from time to time. It's called Neonatal Abstinence Syndrome, or NAS. This is when a newborn is born addicted to a drug because the mother was using it in the final weeks of pregnancy. So the most common drug when we see this is opiates, like heroin and oxycodone, but it can be caused by other drugs as well, like methamphetamines and stuff like that. But the really sad thing about neonatal abstinence syndrome is that these drug-addicted babies, they'll pretty much instantly start suffering from withdrawal effects at birth. So, it's a bad situation enough to get kicked out of the womb and have to live in the real world, but they also are suffering from drug withdrawals, right? I don't know if you've ever seen a drug addict going through withdrawals, but it's not pretty. And for a lot of these newborn babies, it's more than they can handle. These drug withdrawals could be fatal to the newborn. So what a lot of the times medical professionals have to do to keep this baby alive and help them to develop into a healthy child is to actually give them small doses of the drug and kind of gradually wean them off of it, just like how you would treat a adult who's trying to get off of a drug addiction. It's the same process, detoxification. So drugs, that's one big category of teratogens. Another big category would be various diseases. Here's just a few, and the kinds of developmental effects that they could produce. As I mentioned before, I'm not going to go through this point by point, but you can see how a lot of these, scarier diseases and less scary things like chickenpox, for example, they could have serious detrimental effects. Just like stress, as I was talking about earlier, a lot of people don't really fully appreciate how harmful disease can be on a developing baby. When my second child was, conceived and developing prenatally, I actually contracted this weird disease. I've never heard of it before. It's called hand, foot, mouth disease. I got it from my first child, and he picked it up at preschool. Preschool is like a little petri dish of germs and stuff. It's gross. But anyways, he picked it up there, he gave it to me, and it freaked me out because I knew if my wife got it too, it might affect the baby. So I actually had her move out. It's very important for pregnant mothers to stay disease-free. And if that means they have to quarantine themselves, I guess that's what you got to do. It's better be safe than sorry, right? But when it comes to various diseases, one of the scariest ones on the list is, of course, AIDS, autoimmune deficiency syndrome. And children can be born with the HIV. It sounds weird to call it the HIV, but that is grammatically correct. The human immunodeficiency virus. So a child could be born with the HIV either prenatally, like they might actually contract the virus through the placenta. They might contract the virus during birth by coming into contact with the mother's blood. I don't know if you've ever seen a childbirth, but it's not pretty. I don't want to go into gory details, but it can be bloody. Or a third way is by contracting the HIV after the child is born through breastfeeding. It might sound surprising, but yes, HIV can be transmitted through breast milk. It's not terribly common, but it can happen. And though kids born with HIV are more prone to all kinds of disease, they can usually reach adolescence thanks to our modern medicine. We have various treatments for these individuals that can prolong their lifespan and help to manage the symptoms. But as I'm sure you're aware, we don't currently have any cure for the HIV. So that's a pretty serious kind of teratogens. The third kind that I mentioned are just other things in the environment, like air pollution, lead, mercury, PCBs, and X-rays, to name just a few. But one of the ones that we talk about the most and we understand the most is lead. It has been clearly established that childhood exposure to lead can cause developmental and behavioral problems. But when it comes to prenatal exposure, we don't know as much. We know enough to try to avoid lead exposure altogether. It's just bad in general. But the evidence that we have collected so far suggests that the child is most sensitive to lead exposure in the first trimester. So if the child is exposed to lead, like if the mother has lead in her blood or whatever, this could lead to intellectual deficits. Later trimesters, it doesn't seem to have as profound as an effect. And that's something that's common amongst most teratogens, Just the younger the child is, the more sensitive they are to these harmful environmental agents. When it comes to other environmental things like air pollution and whatnot, these are pretty obviously going to be a problem. If the mother's health is affected negatively, then that's clearly going to be transferred to the child. But there's one thing in particular that we don't really know if it's all that big of a deal or not, and that is cell phones. Cell phone usage has been associated with increased risks of health risks in adults. Like we know that cell phone radio frequency could, in some cases, be a causal factor for diseases like cancer. But whether this could affect the child prenatally is not so clear. It's kind of hard to do research like this. Nobody is going to let you do a study where you try to give a fetus cancer. That's clearly unethical. So the data that we have, the research that we have, doesn't really paint us a clear picture here. So just in general, I would say try to avoid as much as you can. Don't freak out about it. You don't need to ban cell phones from your house or anything. Just try not to overdo things. Use moderation. Now, as I already mentioned, in general, these teratogens and just environmental agents in general, whether they're positive or negative, they tend to have the strongest influence in the first few moments of the child's life. So the first trimester, the child tends to be extremely sensitive. But what's harmful for a human fetus, what's harmful for a human embryo, is not necessarily going to be harmful for other animals. Like we know, to put it nicely, cat residue is not going to be a problem for cats' development, but it is a problem for humans' development. So if you have a pet cat, you want to make sure that pregnant mother, especially early in the child's development, that pregnant mother stays away from the residue. And what might be, fatal early on in this prenatal development might just cause mild deficits later on. So during the course of development, these effects can change pretty substantially. So all I'm saying here is there's a lot of scary stuff out there. There's all kinds of things that could harm this developing baby, and you don't want to freak out about it, because remember, stress is one of them. So what you need to do as a pregnant mother is just try to be mindful of the stuff you put into your body, try to be mindful of the people around you, and try to just live a nice, fat, healthy, happy lifestyle. And maybe don't use the cell phone too much. Even if you provide the best possible environment for your developing baby, certain things could go wrong. And that's where prenatal diagnosis and treatment comes in. We have things like genetic counseling, talking about family medical history, and things like that to try to just get a general sense of how likely certain genetic problems are in your family. Like we know, for example, depression runs in families. But we also have very specific techniques for trying to predict medical problems, such as ultrasound, which uses sound waves to generate an image of the fetus. I don't know if you've ever seen an ultrasound, but this is a pretty cool tech. It's something that can be done by just about anybody. Obviously it requires training, but It's a really cool kind of technique and technology that allows you to see your baby very early on in development, and it's completely harmless. It seems no real consequences, negative consequences, have been identified for ultrasound. But there are other techniques that are much more invasive and could potentially have some negative consequences. I've never seen these things performed, but I have met people who've experienced them, and they're done in more extreme cases. Like you have things like amniocentesis, where you use a syringe to withdraw amniotic fluid through the mother's abdomen. It sounds a little scary, but obviously these are medical professionals. They know what they're doing. But they're not going to do it unless they think they should. They have a compelling reason. And then there's chorionic villus sampling, where you surgically remove a piece of tissue from the placenta. And like I said, I'm not a medical professional, but this sounds like a scary procedure to me. This sounds like something that could have some serious risks to both the mother and the developing baby. But these people know what they're doing. And I think it's pretty amazing that people can do this kind of stuff without causing any harm to the developing baby. And if this is the kind of stuff you're interested in, then what you would want to get involved in is called fetal medicine. That field of medicine that's concerned with treating prenatal problems before birth. And there's a lot of different treatments that you could do. You could administer drugs and hormones to try to treat things like fetal hypothyroidism. You could do that kind of fetal surgery I was describing to treat problems like spina bifida, circulatory problems, and things like that. And you can even do genetic engineering using, new techniques like CRISPR, for example, to replace defective genes with synthetic normal ones. There's all kinds of cool new techniques and procedures that are being developed all the time to make sure that babies are being born at their peak of health and well-being. So I think this stuff is super cool. I'm not a medical professional, but I have a lot of respect for the kind of people who do this work.